Okay, let's talk about blood vessels and their branches. So we just finished up talking about the cardiovascular system in general. The heart is a pump. We'll come back and talk much more about that in chapter 12. And then, so the branches of the aorta. Go, come on. There we go. We talked about the aorta, we talked about the pulmonary trunk and kind of the pulmonary and systemic circuits. But what I want to talk about now are the branches off the aorta and on the arterial side. And we're going to go arterial side first and then venous side. So I think your book has it a little bit different, and it talks about some major branches off the big vessels, and it jumps back and forth between arteries and veins a couple of times. And I would much rather just stay on the arterial side. I think it's a little bit easier to understand if we just talk about the arteries first and their major branches and then come to the veins. When we talk about arteries, we're going to talk about branching away from the heart. When we talk about veins, we're going to talk about merging back towards the heart. So the aorta has three sections: the ascending aorta in the thoracic cavity, the ascending aorta, the aortic arch, and descending aorta. And there's three major branches off of the aortic arch that branch to three elastic arteries: the brachiocephalic trunk, that branches into two other vessels, one called the right subclavian. Subclavian is under the clavicle. Clavian is clavicle, yes. And the right common carotid artery. And a second branch off of the aortic arch is the left common carotid artery, and then the left subclavian artery. So take a look. We'll take a look at these as we go in a couple of slides here. So the common carotid arteries basically supply blood to the face, neck, and the brain. And if they have a common of a vessel, it branches to an external and an internal vessel. So the common carotid arteries branch to an external carotid artery and an internal carotid artery. The external supplies blood to the neck and the esophagus, which is your throat, pharynx, which is your basically the back of your throat as well. The esophagus is your food pipe. I'm going to call it that. The larynx is your windpipe, right, or your voice box. And then your lower jaw, the cranium, which is the skull bones, and face. And then the internal carotid artery is a big deal because it delivers blood to the brain and the eyes, really important areas. Another branch there are called vertebral arteries that fuse to form something called the basilar artery, which is at the base of basically the surface of the medulla oblongata, a structure we talked about in the nervous system, in the brainstem, that also supplies blood to the brain. So the internal carotid arteries and then the basilar artery merge into a larger set of vessels that we'll talk about here shortly. So here's the branch here that you can see. Here would be the brachiocephalic trunk that branches off of the aorta. The first branch that heads to the right. Up to the brain heads the common carotid artery that splits to the external and internal carotid arteries. Here's a branch that's the vertebral artery, runs up the cervical vertebrae, right? And then out here is the subclavian. So right there's a clavicle. Again, subclavian is under the clavicle. And then basically where this vessel heads under the clavicle, it becomes the axillary artery. And the axillary region of your body is your armpit. So this vessel, again, is the same. This is all the same blood vessel. But depending on where it's located, it is named something slightly different and where branches occur. So the branch up here is the common carotid. This then becomes the subclavian vessel, and right here is the vertebral artery. And then once this vessel continues under the clavicle, it becomes the axillary artery and heads into the armpit area. So those two vessels, the internal carotid arteries and the basilar artery, merge into a ring of connected blood vessels, arteries in the brain called the circle of Willis, or the cerebral arterial circle. So take a look. Right here are the internal carotid arteries that have just been cut. They head up. This circle here is the circle of Willis, or cerebral arterial circle. So the vertebral arteries that merge into the basilar artery here, right? This is medulla and pons. So the vertebral arteries basically merge at the junction between the pons and the medulla to the basilar artery, and that supplies blood to the circle of Willis, just like the internal carotids supply blood to the circle of Willis. And this circle of Willis, the cerebral arterial circle, is major blood supply to the brain. So really important. The subclavian arteries, so let's head back down to the arm area, the shoulder area. The subclavian arteries branch to the basically merge into the axillary artery. The axillary artery becomes the brachial artery, down the brachial region, the upper arm of your body. And then the brachial artery branches to the radial and the ulnar artery. So just branching upon branching upon branching. So you should be able to identify these vessels. So here's the brachiocephalic trunk. It branches up to the common carotid and the vertebral artery, and then out to the subclavian, continues to the armpit area as the axillary artery. And then here's the brachial artery down the brachial region of the body, upper arm, and then the branch to the radial artery that runs along the radius, and the ulnar artery that runs along the ulna. All of this is blood supply, basically providing blood supply to the arm and muscles of the arm, tissue of the arm, any tissue. So there's the ascending aorta, the aortic arch. We talked about the branches off the aortic arch. And the common carotid, this is the left common carotid. It is exactly the same as the right common carotid, but the right common carotid branches off of the brachiocephalic trunk, whereas the left common carotid branches right off the aorta. And then the left subclavian is here, where on the other side, we've got the brachiocephalic trunk merging into the right subclavian. The left subclavian is a direct branch off of the aortic arch. And then the branching down the left arm is exactly the same as down the right arm, so we're not going to talk about it because we've already talked about the right side. The descending aorta, this area here, heads into the thoracic cavity. And basically the diaphragm, this muscle here, breathing here, separates the thoracic aorta here in the thoracic cavity from the abdominal aorta here in the abdominal cavity. So down in the abdominal cavity, there's three major branches that I want you to know off of the aorta, the abdominal aorta, that supply blood to the abdominal organs, like the stomach, the liver, the spleen, the small and the large intestine, and portions of, basically all portions of the digestive system. And those three branches are called the celiac trunk, that has three branches off of it. A trunk of a vessel usually has branches off of it almost immediately, so it's just shortened. Like think truncated is shortened. The superior mesenteric artery and the inferior mesenteric artery. So take a look here. This is the abdominal aorta that runs down through here, from the diaphragm all the way to where it branches just behind this part of the intestine. So the three branches that I just mentioned, right here's the celiac trunk, and there's its three major branches. It supplies blood to the stomach, the liver, and the spleen. You should understand that, basically where blood is supplied to. The superior mesenteric artery branches off of the abdominal aorta superior to the inferior mesenteric artery. And the superior mesenteric artery supplies blood to all of the small intestine, which is all of this here, and the first third of the large intestine, first 2/3 of the large intestine. And then the inferior mesenteric artery supplies blood to the last third of the large intestine, the sigmoid colon that's shaped like an S, and then the rectum as well. Once the abdominal aorta terminates, it splits, it branches to a right and a left common iliac artery. Think about where the ileal region or iliac region, so think about where the ilium, the bone, is located in your hip, right where your hip bends. Those blood vessels, so right around your belly button, is where the abdominal aorta stops and branches to the right and left common iliac arteries. And again, if you have a common of a vessel, it splits to an internal and an external. So the common iliac arteries branch to an internal iliac and an external iliac artery, and the external iliac artery becomes the femoral artery. We'll talk about where here shortly. The femoral artery becomes the popliteal artery. And think the popliteal region of your body is behind the knee. And then the popliteal artery branches to anterior and posterior tibial arteries, and the bone in your lower leg. One vessel runs anterior and one runs posterior. And then the posterior tibial artery branches to the fibular artery, which runs along the fibula. So take a look here. Right, here's the common iliac. This is anterior and posterior. So the anterior, so you see common iliac. This common iliac splits right here to the internal iliac artery and external. And when this external iliac artery runs through this big ligament, it becomes the femoral artery. The femoral artery then runs down behind the knee. So I'm going to run to this side. And right here's the popliteal artery. So right here's the femoral, starts anterior, runs posterior. And where it runs behind the knee, it becomes a popliteal artery that branches to the anterior tibial that runs down the anterior, kind of runs right between the tibia and fibula anteriorly down the leg. So you can see it kind of poking through over here, the darker vessel. The lighter vessels are behind this, or posterior. And then the posterior tibial continues down the leg, the back of the tibia, oops, pushed forward. And then the fibular artery branches off of the posterior tibial, right? Crazy. So those arteries you should understand, be able to identify. And in general, where I talked about what vessels supply blood to what structures or regions or organs, you should know that as well. On the venous side of circulation, we're going to talk about blood drainage as opposed to blood supply. So the external jugulars, internal jugulars, drain blood from the same areas where the carotid arteries supply blood to. And then the same thing goes for the vertebral vein. There's a vertebral artery and a vertebral vein. And those three vessels merge into a subclavian vein to form a brachiocephalic vein. So you're going to notice some very similar names on the arterial side versus the venous side. And then the external jugular vertebral vein and internal jugular vein, again, they drain back into the brachiocephalic veins on both sides. So this is similar on both the right and the left side to form the vena cava, superior vena cava specifically. So take a look. Here's a vertebral vein where the vertebral artery would be located here. You only see veins. There's the external jugular that is a smaller blood vessel than the internal jugular draining blood from the brain. Those three vessels merge together along with the subclavian vein here to become the brachiocephalic vein. And that's exactly the same on the right side versus the left side. So we're only going to talk about one side. So here's the vena cava. So the right and left brachiocephalic veins merge into the superior vena cava. So let's head down into the arm. So we're going to start with, we basically talked about arteries branching away from the heart because they carry blood away from the heart. We're going to talk about veins merging back too. So down in the lower arm, there's median cubital vein that connects basically the ulnar and what's two veins called the cephalic and basilic vein. I'll show you these on a figure next. The ulnar and radial veins merge to the brachial. So remember, the brachial artery branched to the ulnar and radial arteries, but now we've got merging of veins back towards the heart because they're carrying blood in that direction. And the brachial and basilic merge together to form the axillary vein. Axillary vein merges with the cephalic vein to become the subclavian. Well, there's a lot of words going on here, but I'll show it to you on an up and coming slide. The subclavian veins merge with the jugulars and the vertebral to make to merge into the brachiocephalic vein, and then the right and the left brachiocephalic veins become the superior vena cava. So that's kind of what we talked about on the last slide a little bit already, but take a look. Now we're going to add more to it. So right here is you've got two different colors here because veins have a superficial set of veins and a deep set of veins. So they're a little bit different from arteries. Some similarities, but some differences. The differences are basically the superficial veins, whereas the deep veins, the darker color here, you see the brachial vein and the radial and the ulnar vein. That's very similar to the arteries. Here's the differences. Here's the basilic. Right here's the cephalic, and these run all the way up the arm. This is still the cephalic and the basilic running all the way up here. So in the upper arm, you see three, and they run in alphabetical order from medial to lateral. The basilic vein, the brachial vein, and the cephalic vein. B-A, B-R-C, alphabetical order. So take a look here. The ulnar and radial veins merge to the brachial vein. Those are deep. The brachial vein merges back with the basilic vein to become the axillary vein here. The axillary then merges with the cephalic to become the subclavian vein under the clavicle, and then the jugulars merge in with the vertebral vein to create the brachiocephalic vein, and the right and left brachiocephalic veins merge into the superior vena cava. So flashcards are going to be your best friend when it comes to these kind of blood vessels to study and remember them. Okay, so let's talk about, there's this, basically blood also drains from the thoracic cavity to the superior vena cava. So any blood that's coming basically superior or above the diaphragm drains into the superior vena cava. Blood from areas below the diaphragm drains into the inferior vena cava. So you've got two vena cavas. They merge together in the right atrium to deliver oxygenated blood to the heart. And there's two veins in the thoracic cavity, major veins in the thoracic cavity that drain blood from the thoracic cavities into the superior vena cava, the azygos and hemiazygos veins. The veins we just talked about are draining blood from the extremities, the upper arm, the arms, and the head. So in the thoracic cavity, also above the superior vena cava, you've got these two major veins that are continuing to drain blood as well. So the blood basically below the diaphragm, again, merges into the inferior vena cava, and there's a couple of veins here, the hepatic and renal, that drain into that inferior vena cava, and we'll take a look at them. So these are the major ones. We're only talking, there's lots more than what we're talking about, but we're only going to talk about the major ones that I want you to know. So right here on the right side is the azygos vein that drains into the superior vena cava. The hemiazygos is on the left-hand side, that drains into, right here is a brachiocephalic, and then into the vena cava. So you've got the azygos vein that's draining blood from the right thoracic cavity, hemiazygos vein that's draining blood from the left thoracic cavity. They both empty into, eventually, the superior vena cava. Here's this diaphragm. So this is the inferior vena cava here. And the inferior vena cava is draining blood from the liver by way of the hepatic veins, and then from the kidney by way of the renal veins. So the kidney is renal, right? Again, there's lots more vessels here, but I want you to know those major ones. And you've got blood flow to the abdominal organs by way of the three branches off of the abdominal aorta that we talked about, the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. Well, the hepatic portal vein is what drains vessels, basically where that blood is supplied to. The hepatic portal vein is draining blood from where those arteries supply blood to, by way of the superior mesenteric vein, inferior mesenteric vein, and the splenic vein. So those three vessels merge together to the hepatic portal vein and send blood into the liver. And then from the liver, blood is sent to the hepatic veins to the inferior vena cava. This is crazy. Take a look. So here's blood flow coming from the digestive system organs, where you've got a capillary bed and the digestive system is sending nutrients and substances, ions and water into the blood. Well, it has to be filtered first. So the liver does that job. But to get blood to the liver from the digestive system organs where nutrient absorption is occurring, you've got the inferior mesenteric vein. The superior mesenteric artery supplies blood to these structures that are draining blood from the structure in the inferior mesenteric vein. The superior mesenteric vein, and right here's the splenic vein coming from the spleen. Those three vessels merge into the hepatic portal vein, this big vein right here, and that blood coming from the digestive system where nutrients have just been absorbed and maybe even some stuff that you don't want in the blood that gets sent back to the heart, gets sent to the liver to be filtered. Once blood is filtered and clean, that blood gets sent through the hepatic veins back to the inferior vena cava. So this hepatic portal vein, its job is to take the blood that's coming from the three vessels we talked about, where blood has been basically absorbed or nutrients have been absorbed from the digestive system and sent back into and basically cleaned by the liver before it gets sent back to the vena cava. And blood drainage in the lower limb is illustrated here. I think I'm going to use the figure to demonstrate, because it gets kind of confusing when I'm just going to read through the slide. So I want to show you this here. So if you want to follow me, down in the lower leg, you've got two additional veins that on the arterial side we don't have. So we still have, so this is anterior and posterior, we still have the fibular vein, like we have the fibular artery. That merges into the posterior tibial artery, or vein, excuse me, like we had a posterior tibial artery. The anterior tibial vein merges into the posterior tibial vein and becomes the popliteal. So these are very similar to the branching patterns of arteries. The popliteal becomes the femoral vein. This is where veins differ. There's a vein called the small saphenous vein This small saphenous vein runs laterally from behind the knee down the leg. And when it merges with the popliteal vein, this vessel becomes the femoral vein. So that femoral vein, just before it becomes the external iliac vein, it merges with this huge long vein called the great saphenous. You have a small saphenous and a great saphenous. This great saphenous vein merges back with the femoral for this vessel to become the external iliac. So flip me over here. Right here's the femoral, right here. And then the great saphenous merges together, and this vessel becomes the external iliac. And then the internal iliac merges in to become the common iliac. And the common iliac veins merge together into the inferior vena cava. Whew, that's a lot. But in that, we have now covered the major branches of both arteries and veins, I want you to know, and talked about where blood supply is supplied to or drained from by the major vessels. So again, flashcards are going to be your best friend here. Make sure that you are kind of just studying and then going back over this material over and over again. So I will see you in the next chapter.